This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Diseases that were essentially absent during COVID are reemerging and behaving in really strange ways. There's RSV, adenovirus, hepatitis, monkeypox, tuberculosis. What is going on here, and what is the relationship between this phenomenon and COVID? In this week's episode, I speak with Dr. Beth Kressel, infectious disease specialist, about why these diseases are roaring back. Our conversation is next. Dr. Kressel, it's always great to see you. Thank you again for hopping on. So we're talking about diseases that were essentially absent during COVID, and they're emerging and behaving in these really strange ways. Like RSV, adenovirus, hepatitis, monkeypox, tuberculosis. What's going on here? And what's the relationship between this phenomenon and COVID?
Well, I think for RSV and influenza, the social distancing that we had during the first phase of COVID really reduced those infections. There were studies that saying that a lot of illnesses in children came down or reduced during that period. Even some surprising ones like dengue, where they think that maybe mosquitoes were biting children in schools. And then when schools reopened, dengue increased. So I think part of it is, I'll say simple. It's never really simple. But when people were staying away from each other, then things that spread person to person reduced. And now everybody is out and about, right? We just can't wait to travel again and see each other. And so some of these things like RSV and influenza have come back. But you're right, they're behaving oddly. Usually RSV is a winter illness, and it came roaring back in the summer. And it's been behaving very oddly ever since. So I don't know that we fully understand it. With respiratory viruses as well, there is some competition. So when COVID was really prevalent, the other respiratory viruses were mostly no-shows. And it's not clear why they would interfere with each other, but they do. Back in 2009, when H1N1 swept through, all the other viruses went into hiding. So that's a phenomenon that's known with the respiratory viruses. Some of it's understood, some of it's not.
Well, I'm wondering, are these sort of diseases roaring back? Or are they just kind of emerging as they would have been here? But monkeypox, tuberculosis, these are, I haven't heard of these things being around even before COVID very much.
Well, there was a low level of tuberculosis in the United States pre-COVID. Monkeypox is very interesting, and I don't think it's related to COVID except indirectly. Like, in other words, international travel was really reduced during COVID, right? Now people are traveling internationally and we're seeing monkeypox. Now, that's not a complete explanation because before COVID, people traveled a lot and we didn't see what we're seeing now. So in the past, people got monkeypox after traveling to parts of Africa where it is present at low levels. Monkeypox has been slowly increasing in regions of Africa for a few decades now. Probably because smallpox vaccine gave people immunity to it. And now, we haven't given smallpox vaccine in decades. So a lot of people are not vaccinated at all. And people who have been vaccinated, their immunity is slowly fading. So what has happened with monkeypox is, you've got that low level increase in Africa. Although they would say it's not low level. There have been a lot of cases in Africa. And now we're traveling. And monkeypox is spread with close contact. So this current outbreak seems to be related to sexual spread. And, well, when you're intimate, you have close contact, literally close skin to skin contact. So it's found a new way to spread. And now it's spreading that way in non-African countries, where normally we would only see it in travelers in very small numbers. So it's indirectly related to the fact that we're traveling more, but it was just a right series of events where you've got more monkeypox cases in Africa, more people traveling, and then probably a very one encounter, right? One way for the monkeypox to spread in a new population. The cases seem to be related to each other genetically.
And I mean, how concerned should we be about monkeypox right now here in the U.S.? And then I mean, I'm not sure how many cases are landed here. I mean, the level of concern has increased, but your reaction to the World Health Organization and the latest level of concern that's increased.
I don't know the full scope of monkeypox yet. The fact that once the reports came out of cases in the United Kingdom of monkeypox cases in people who had not traveled to Africa themselves, that was kind of an alert for other people to look for it. Now that people are looking for it, we're finding more and more cases. It's been circulating for a while. I think that's what that tells you, is that you've got you got over 1,000 cases in over 20 countries, and most of them have the same genetic signature. That means it's been circulating for a while under the radar. How long? I don't know. But it's been under the radar until somebody said, maybe this is monkeypox. And now everybody's looking for it and finding more people. So I think we're not going to understand the full story for probably another month or so. I would expect we're going to be finding more cases in the United States because we're looking for them now. We know it's here. And it wasn't recognized because we think of it as a travel-related illness. And the rash was the way people are presenting with this monkeypox outbreak. It's not typical. It's not typical of monkeypox. So it's presenting in a strange way in people who we normally wouldn't think of having it. I am moderately concerned. I think the big question is, will this be containable or not? Is this something that we're just going to stop and it's just going to be gone? Or more precisely, will it be gone from non-African countries or not? Or is this something that will be present at low levels for a long time? And that, I don't know.
And what about, Dr. Kressel, the RSV and the adenovirus? I mean, I'm just thinking that are these just, we haven't been paying attention to them, and they've kind of, I mean, we talked about the phrase that you said, viruses sort of outburn the other viruses. So is this surprising? Should we be alarmed that we're seeing cases of this, or is this just, we're going back to, I mean, pandemic is sort of, I don't know, COVID, well, we still have it. It's still very present, but what's your reaction to that?
I don't know what's going on with RSV. I mean, I think RSV, it did reemerge in the summer when it normally doesn't. At the same time, we were reducing COVID precautions. So I think that was understandable. But what I don't understand is that it seemed to go away, and then cases are starting to crop up again in the summer. So that is very odd to me. I don't have a good explanation. And I don't know if this is a new pattern for RSV or not. I feel like it had one weird RSV season I would understand. I don't know if I understand the continued odd behavior.
I mean, it just seems like COVID just turned everything upside down and just changed the rules. So, I mean, I guess it's going to take us a while to figure out what's going on here, if this is going to be long-term or something. So many questions and I just don't have answers yet. How has the pandemic affected our immune system, do you think? I mean, I imagine we did what we needed to do. We social distance, we wore masks. But I imagine now a kid touches a germ, they're going to, just, be in bed for a week. I don't know.
I don't know about that. I mean, I think the majority of people now have some degree of immunity to COVID, whether they got infected at some point or got vaccinated or both. I think the good news with COVID is that even though cases are higher, cases are clearly increasing right now in Indiana, but hospitalizations, although they're increasing, they're not increasing as high as they have been. And the people who are hospitalized are not as likely to be in intensive care. And for all the COVID cases we have, so we have more COVID cases now than we did the same time last year, but deaths are lower. I think, though, before we celebrate and do victory lap, we should reflect a little bit on why that's happening. And I think it's partly the vaccines and partly the antivirals. So COVID is still not something to be taken lightly. And if you are older, or if you have other chronic illnesses, or if you're immunocompromised and you have COVID, you should not take that lightly. You should remember that one of the reasons that the death rate is dropping is that we have antivirals. So if you're sick, test yourself for COVID, and if you have COVID, you should get antiviral treatment. I think that's the right message. We have tools that we didn't have in March of 2020, right? We have the vaccines and the antivirals.
And then what about in terms of other viruses or other germs or other diseases that we can catch? I was just thinking that because we've had these restrictions, which were very crucial during this time and still are. But I mean, I just imagine people are going to be more likely to catch something like a cold and have it be worse because their immune system maybe hasn't been used to it. Because I don't know. I'm just kind of thinking out loud here. Your reaction to that?
There might be some of that. Because normally we're exposed to things on an ongoing basis and we get some immunity. Having not seen things for 2 years, it could be your first cold might be more severe. I don't know. I'm not that concerned. I think it's odd, though. I mean, I think that, we had a very prolonged influenza season this year. It wasn't the worst influenza season, but, we had influenza cases in June, and RSV is acting strangely. I think the thing is just be aware that things may be cropping up outside their usual zones. For example, young children should probably be tested for RSV if they're sick, if they would benefit from treatment.
And then, Dr. Kressel, we have about a minute left. Any last thoughts on this sort of strange way these viruses are emerging and behaving in, like we said, these really odd ways?
Yeah, it's exciting and tiring at the same time. I think that diseases are emerging more quickly than they used to. If you look at the arc, look at before SARS-1. SARS-1 was 2003, 2004, right? And look at the gap between SARS-1 and H1N1, right? That was about a 6-year gap. And then look at everything that's happened since H1N1 with MERS and Ebola and COVID, and now monkeypox, right? It does seem that things are emerging more quickly. And I think it's partly travel. We can travel more quickly than we used to. There are more people on the planet, more interactions with the edges of civilization, right? People pushing into wilderness. So I think it's complicated. It's interesting and exciting, but I'll admit a little tiring at the same time.
Well, Dr. Kressel, always great to see you. Thank you so much for your time.
Thank you.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast and discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.